Charlotte, talk about the Gerson therapy and how it came about.
It's kind of a long story. My father was a doctor. He went through the medical schools and, residency, internship, residency and all, and was trained just like all other doctors, diagnose and then treat the symptom, and, there's drugs and so on. However, all of this was before the First World War. And he had one great big difference from others. He was suffering terribly from migraine headaches. Apparently hereditary. His mother had the migraine headaches, and by the time he was through residency, he was sometimes laid up in bed with terrible migraines and eye damage and hearing damage and all that for 2 and 3 days a week. And he begged his doctors, teachers, professors, what am I going to do? And they all referred him back to the books, and the books said, nothing you can do, and, just learn to live with it. But I can't live with it. Well, when you get to be 55, you'll feel better. But I'm 25. Okay, so he decided he wasn't going to live this way, so he would have to find some way of healing himself, or he didn't want to live. So he started to search. By this time he had an MD degree. And he looked up other doctors and professors and teachers, and he subscribed to medical journals also in other languages and had them translated and studied and studied and tried and tried. Finally, after a long time, year or two or more, he ran across one little item, and the item said that there was a woman, apparently in Italian, a little Italian magazine, who had changed her diet and was better. Diet? Nobody told him about diet. Never learned in school about diet. Diet is in the kitchen, the cook. Anyway, but he was so discouraged with everything else, he thought he might as well try. And he started to think about diet. And he thought about milk, and every baby can handle milk. He certainly couldn't be allergic to it, and he tried it. He was just as sick as ever. And then it really occurred to him that nowhere in nature, animals, once they're weaned, ever drink milk. Certainly not milk from another species. So he decided to do what our kind of physical ancestors do, and I don't want to tread on any religious toes here. He decided to try vegetarian food. Living in Germany apples were available any season. So he lived on nothing but apples for a little while. Raw apples, applesauce, apple juice, baked apples, cooked apples, all kinds. And he was fine. Starting from that information, he would add one thing after another, and if something didn't agree with him, he could have a migraine within 20 minutes. So he worked out piece by piece by piece, adding one thing after another, what he called his migraine diet. And it worked for him. When he stayed with it, he was fine, no more pain. So a little later, when he finally settled in his practice, his own practice, he had a shingle out, and the shingle read internal and nerve diseases. He had done the completion of his treatment of his training by one of the top neurologists of Europe, man by the name of Ottfried Förster in Breslau. Meantime came the First World War. So he was working with Förster in Breslau during the first years of the World War. And that's why his single read internal and nerve disease. He was specialized. One day a patient comes to him and complains of migraine headaches, And he says, well, there's no cure, but I had migraine and I'm doing this, 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 and this. Why don't you try it? It's not written up anywhere, but it works for me. Anyway, the patient comes back 3 or 4 weeks later and says, Dr. Gerson, my migraines are gone, but I also had skin tuberculosis. That's called lupus vulgaris. It's not like the lupus erythematosus. It's called lupus vulgaris, skin tuberculosis, and the man who discovered it and found it was incurable got the Nobel Prize. So my father said, no, no, it's an incurable disease. And, but the patient produced laboratory reports that the lesions he had on his arms or wherever did indeed have tubercle bacilli. My father couldn't understand the relationship of a tuberculosis infection and migraine headaches. But he wanted to know. This was something entirely new. So he said, look, my shingle reads internal and nerve diseases, and I don't see skin problems like that. Do you know anybody else? Rather rare kind of disease. And the man said, oh, yes. I had a lot of people, friends in the hospital, and they all had the same problem. Send me some. I'll treat them free of charge. I just want to know. Well, that's what happened. He treated them free of charge, and it worked. This came to the ears of the most famous lung tuberculosis specialist in Europe by the name of Sauerbruch in Munich. My father was in a city in northwestern Germany called Bielefeld, Westphalia, where I was born too. And Sauerbruch was questioning, couldn't believe this. So he asked for my father to come to him. He was a big professor. Okay, and my father, in those days you didn't fly. This was before World War I or right after. And so my father took the train, went on down there 8 hours, and discussed this with Sauerbruch. And Sauerbruch said, okay, we'll test it out. And I'll get a bunch of patients together and give them the therapy you proposed, and we'll see. He got together 450 patients, and I don't know if you're familiar with this. It's not a disease nowadays that you see much of, but I remember as a child seeing pictures and seeing patients with part of their nose missing from tuberculosis, or ears missing, or big lesions in their face. Of course, it didn't see the rest of the body, and so on. And Sauerbruch put together 450 advanced tuberculosis, skin tuberculosis cases, and he said, Gerson, if you can only stop one of them, the advance of the disease, I'll believe every word you say. Well, after a while, 446 recovered out of the 450. And Sauerbruch was just out of them. Besides, he was the big professor, so it had his name when he published. Okay? And he then continued using this therapy for tuberculosis. But my father wasn't satisfied with skin tuberculosis. He said, if tuberculosis can be cured, it's a germ. Why not skin tuberculosis, so why not lung tuberculosis? This was deadly. And a lot of young people particularly used to die of the so-called galloping lung tuberculosis in the teens, late teens, 19, 22, 23, that sort of age. So my father was called to a large station of lung tuberculosis in Berlin. And he went there, and he started to treat patients there. And sure enough, the lung tuberculosis responded, but something else happened, and that changed everything. He discovered that a lot of those patients had other problems. Besides lung tuberculosis, some had kidney damage, some had asthma, some had high blood pressure or low blood pressure, various other diseases. and they too disappeared. And that's when he began to understand that he was no longer treating a disease, that he was restoring the body's ability to heal itself. And that's, of course, when he parted company with Orthodox medicine. And when he developed this further, he found that virtually any chronic degenerative disease was curable. And then he still had to make some alterations before he was able to cure advanced cancer. But he could do that too, by restoring the body's defenses.